Now, ladies and gentlemen, we have a spotlight session which will highlight how AI is revolutionizing cardiac care, turning cutting-edge theory into real-world solutions. And for this, please do welcome back to the stage Dr. Yazan Aljabery, cardiac surgery consultant and assistant professor of surgery at Cleveland, Abu Dhabi. Over to you, Doctor.
Assalamu alaikum and good afternoon, everyone. As a cardiac surgeon, one thing comes to mind every time I walk into the operating room and look at the patient sitting there waiting for his open heart surgery to be done. How could this have been prevented? Well, I'll tell you, it's not because I don't want to work more, it's because I don't want to be in his place one day. Can we prevent that? And the answer simply is, research has found that more than 80% of cardiovascular disease can be prevented by lifestyle and longevity approaches only. And how is that done? It sounds very boring, but we go back to our 6 pillars. Nutrition, physical activity, sleep, toxic substances, stress management, and last but not least, we are talking about connectedness. But as a human being, our nature is that we get bored very fast, especially with long-term goals. So what can help us with that? In my opinion, wearables. Wearables are there not just for you to track your daily progress, but also to set short-term goals. And as caregivers, we should use that utility to guide us on how these patients are following what we recommend them to do, and the progress that they're making. And for me and those that know me, I am a big fan of wearables. You always find me wearing my ring, wearing the watch. And that's not because I want to try them, but because I believe that each one of them has a use and a unique benefit to our patients. For example, this watch that I'm wearing here is one of the watches that tackles one of the biggest problems, and it's hypertension. Until this day, we struggle to measure hypertension in patients and ask them to record their 4 measurements a day, do a diary, present it to us. But using things like this, it can easily do that at any setting. No need for special monitors. No need to wake up at night, do your measurements, that annoying cuff. No, you have that thing in your hand, you just press on it, and it shows you your blood pressure anytime and anywhere. Things like this ring or the continuous glucose monitoring, I find them extremely spectacular because they guide you personally, and we're talking about personalization all the time. They know exactly what fits you and what doesn't fit you. The lifestyle modification that you need to do, not based on big research, but based on your body and your personal findings. And then I thought, okay, taking that all into consideration, what can we do differently to improve our cardiac surgery patient outcomes? And I found out that the biggest gap we have is after discharge. So we usually discharge our patients at day 5 or 6. They go back home. And the first 30 days are the days which are most critical for these patients and where the complications usually happen. But for us, until this day, it is a black box. It has always been a black box. Nobody can track what patients are doing. And the only time we see them is when a complication happens and they come to the emergency department, and usually that's being reactive and that's being too late. So what I did is I led a pilot 1.5 years ago using a very small wearable that you stick to your chest, connect it to your phone, and from your phone to the cloud and to our command center. We have managed to follow those trends 24/7 using dedicated nurses sitting in the command center and watching over you even when you're at home. And what did we come out with? I'll tell you, we have saved more than 15 to 20 patients out of 100 who were about to have very serious complications. And we have detected those complications even before the patient himself felt that. And one example of which I always like to mention was a very young patient, 39-year-old, had an open heart surgery, valve replacement, was sent back home, and we have noticed that his heart rate was going up, his skin temperature was slightly going up, but he was restless and he wasn't sleeping well. So we picked up the phone, called him on day 10, and he said he's not feeling anything, everything is fine. He just mentioned that his stool has been looking more darker and darker each day. So we asked him to come to the emergency department, and we found out that he was having GI bleeding, actively having GI bleeding, and his hemoglobin already dropped 3 points. The other scenario would have been that he would have waited and waited on what he has thought that this was a normal finding, and he would have came in a shock condition, and we never know, could we have saved him or not? That was the big question. So I think these wearables are not just a very good way to limit our short-term goals and as healthy individuals use them on our day-to-day lives, but for every discipline, for every doctor and physician that's out there, these wearables can be a tool to track our patients' progress. We can use them in our clinics, and we can even set goals for them, short-term goals for them, to actually use them on our follow-ups and use them as a tool to empower patients to be part and integrated into their well-being rather than being reactive. My last message would be, as always, our goal in prevention is to move from what current hospital models are, and that's treating the sick, or what I like to call sick care, to actually moving to treating or preventing healthy individual from becoming sick, and what we call proper health care. Thank you so much for being here. Thank you for listening to me.
AI in the heart of healing. Thank you so much, Dr. Yazan, for those fascinating insights. Please do give him another round of applause. Thank you.